I'm Jeannie Gaines with the Alabama Department of Public Health Comprehensive Cancer Control Program. I'm here today with Dr. Gabrielle Rocque from the University of Alabama at Birmingham. Good morning, Dr. Rocque.
Good morning. Thank you for having me.
So tell us a little bit about your role at UAB.
So I'm an assistant professor in the Division of Hematology and Oncology, and I'm also the medical director for the UAB Health System Cancer Community Network. And in my day-to-day practice, I see patients with breast cancer, primarily patients with metastatic breast cancer.
Very good. So when a clinician has a patient with metastatic breast cancer, what do you think are the most important things that he or she should try to address?
I think there are several really important things to address with patients, and perhaps the most important is the goals of treatment. So the goals of treatment are twofold. First, we want patients to live longer, but also equally important, we really want patients to live better. So it's important when thinking about treatments to consider patients' quality of life and how the treatment is going to impact the things that are really important to them and their time with their family and their friends, because ultimately we really want patients to have the highest quality of life. Another thing that's really important for the clinicians to recognize is that this is a really difficult time for patients. Getting a diagnosis of metastatic breast cancer can be very scary for patients. And so I think it's important for us to consider that and ask questions about how patients are coping, what kinds of supports they need to help them both understand their diagnosis, but as well just process that and be comfortable moving forward with treatment.
Absolutely. How would you suggest that a clinician talk to their patient about telling their friends and family about their diagnosis?
So that's a great question. That can be something that's really challenging for people, particularly if you have women with young children at home. And so it's important for them to, talk to people that they're comfortable with first. And one recommendation that I often give patients is to identify a point person in the family who can be that individual that's going to communicate to everybody else, because sometimes it can be overwhelming for patients to get so many phone calls and people asking questions, and they may not want to tell their story again to every family member or friend that calls. So having that point person can be very important to, disseminating information and helping people care for the patient without being overwhelming. I think another common question that I get is, if you are a family member or friend, how can you instruct them in helpful ways? And so family members or friends can help make food. They can, do sort of basic things around the house or laundry or small things to help in a way. And I think empowering them to be able to participate is really important. And so that point person can then help organize some of that.
Great. What about patients who choose to continue working?
So this is a very important question, and we've had a lot of discussion in the community recently about working with metastatic breast cancer. And I really encourage patients to think about what kind of value do they find in work. If there's somebody who really loves working and that's an important part of who they are as a person, then we really want to maintain that for as long as possible. And so that sometimes can require some conversations with their employer. I think it's important to be honest with their employer about what they're going through and what kinds of needs they're going to have in terms of treatment. Are they going to need to come to the cancer center for treatments once a week, or is it going to be once a month? And to really have an understanding both of what their needs are in terms of clinic visits, but also that they may have to have times where they are more fatigued and they need to rest or have a slightly different job responsibility. But I think it's important for clinicians to be ready to work with employers, to write letters of support, and also really identify from the patient what they want, because I think that really needs to drive the discussion about whether patients work.
Good. Well, let's talk about some resources. What are some that you think could help patients cope or deal with their metastatic breast cancer?
I think in terms of working, there are resources from the Alabama Department of Rehabilitation Services, as well as several others that can really help people identify what is the best way to talk to their employers, what rights they have, and how they can make a smooth transition. In terms of more the kind of social support resources, that is also very important. So there are several, nationwide resources, including the Metastatic Breast Cancer Network, and they're available as an online resource for patients. And that can be very helpful for people who, may still not be ready to share with their, close circle of friends, to have an online support community that they can reach out to, people who've had similar experiences, who maybe are even on the same treatments that they're on, to have, that connection with people, across the country can be very valuable. Some other examples are, cancersupportcommunity.org and cancercare.org. There are also, resources within each of the local cancer centers in terms of local support groups, which are usually mixed of people with early stage breast cancer as well as metastatic breast cancer.
So you mentioned controlling breast cancer for as long as possible. Are you referring to treatment, and isn't all cancer treatment the same?
So not all cancer treatment is the same, and this is a little bit different than the early stage setting in that these patients are going to be on treatment, albeit occasionally with some breaks, for the duration of their life. So it's important to get them the right treatments at the right time. And metastatic breast cancer is actually a really exciting space right now in terms of drug development. There have been several new medications that have come to the market that are improving people's survival as well as their quality of life, and some with relatively low toxicity. So as a clinician, and particularly if you're a community clinician, it is really important to be able to stay up on the literature and to know not only, what drugs to prescribe, but also how to manage them, what to expect in terms of toxicities. And I think that can be hard, particularly for community physicians that are seeing a wide range of cancer types, a wide range of stages. So there are several different resources that the physicians can use, and this is true whether you're an academic or a community practice. And some of the ones that I personally use are the National Comprehensive Cancer Network, the NCCN, has guidelines that we can follow to know that we're providing a standard of care. Also, the American Society of Clinical Oncology and American Cancer Society also have lots of information on, what are the right treatments for patients. I also think that this is an important area where we have to have partnerships between academic medicine and the community practices. So many of the clinical trials that are occurring in the academic settings give us some extra experience with these drugs, and I think it's important to have a relationship between the community and the academic practices so that the community oncologists can ask us questions and can learn from the experience that we've had in the academic centers. Because ultimately, we really want patients to get treated where it is the best for them. And most of the time, that is going to be close to home. But we have to make sure that the community oncologists also feel comfortable giving those new medications. And sometimes it does take some experience and time to get that comfort.
And how do clinicians know the newest treatment protocols?
So, we use some of the national resources that I recommended, like NCCN, but also it is important for clinicians to think about, is there an opportunity to go to a meeting where they're presenting that original research? And if, a clinician can't make it to something like ASCO's annual meeting, there are also local and regional follow-ups to that, things that we call them the best of ASCO, which is really, usually the local providers who've gone presenting that information on what do they think were the most important take-homes, what were the breakthrough drugs that really everybody needs to know about. And so I think that's another opportunity where we can come together and to learn, out of all those different presentations, what are the really practice-changing research that's gone on that really needs to trickle down back to patients.
And how do they find that information?
So they can find that information, through the guideline panels as well as some of these, best of ASCO type meetings. And then also they can, have a relationship with providers that are doing that research who, are telling them, hey, these are the things that I learned. Do you have questions? I have a lot of community physicians who will call me on the phone and just ask me a question about how to manage something, or ask me if we have a clinical trial available at UAB that their patient might qualify for. And I think that interplay is incredibly important for patients to really get the right care in the right place.
So what do you think is the most important conversation that a clinician can have with their patient about metastatic breast cancer?
So I think the most important conversation really is about patient values, because we have all of this information about what the treatments are and what the side effects are, and we have to help walk the patient to the right decision. So I'm a firm believer in what we call shared decision making, which means that both the patient and the clinician really both have a voice and are helping come to the right decision together by integrating patient values with what's the best option for them. And so that really requires a lot of strong communication between both partners. And I think, as clinicians, it's important for us to also encourage our patients to think about what's important to them. For some people, it may be important not to come in as often, that they want to have a treatment where perhaps they're only coming in every 3 weeks or every month. Other patients won't have a problem coming in weekly. They're concerned about particular side effects like hair loss or numbness and tingling in their hands and feet. So I think balancing, what does that patient's life look like? What are their goals with the right treatment option that's going to be the most efficacious, but also have side effects that really match with their goals.
Great. Well, that's some really great information, Dr. Rocque, and we appreciate you joining us today to share your wonderful knowledge. And we thank you for joining us.